as Dr. Kitt said, I've had the unique opportunity to start in our communities as one of our directors of clinical services and support many different communities throughout the state of Virginia. So have had the opportunity and pleasure of having this conversation with lots of our families, families who have maybe already have one loved one in a community and even deciding if it's time for another one. So we're really excited to get into this. And as Dr. Kitt said, please feel free at any time to put something in the chat. We look forward to conversations and being able to hopefully answer any questions you may have. So looking at when is it time to move? So, as we know, there are many factors that, impact this decision to move into an assisted living community. And it's often not an easy decision and very much there's not always an obvious time, an obvious choice. And we know that there's usually a lot of different people helping make this decision for a family member, for a friend, for a partner, for a spouse. And so we want to look at a bunch of the topics that will help take into consideration when you're trying to decide if it's the right time to make this move. So some of those pieces we're going to look at tonight are social isolation, the physical decline or increased care needs a loved one or friend may be having, the importance of medication management, overall cognitive decline and changes, the social infrastructure that surrounds your loved one when making that decision, and overall lifestyle and purposeful living. So social isolation. Many older adults are at increased risk for this due to a lot of factors. So as we know, we hear a lot. My mom, my dad had a really great group of friends. They were involved in volunteer work. They were involved with the church. But as time has gone on, sometimes that circle begins to get smaller. We know that people move. We know that different impacts to just family and friends can make that circle smaller. So living alone is one factor that can have. Sometimes we lose a partner earlier, and that amount of time that we lived alone also can vary. The loss of family and friends, same thing as we age. Unfortunately, that is a process that we deal with. But again, that friend circle sometimes being such an important component to our overall health and well-being, our satisfaction, our purpose in life. And as we look at what the people that are close by and having that impact, that's an important factor to look at. As we know, a lot of families are currently working. They have they have children, they have other people they're helping care for, and oftentimes two sets of family that they're helping support. Chronic illness and health issues. As we age, it is a normal fact of life. We have health needs that can arise, and sometimes those being more significant than others and requiring more support than others. Overall transportation challenges. Sometimes we may be able to get out and about, but not have the means to be able to have that social impact, getting to the appointments we need to get to, getting out to the store. So transportation challenges can also be a part. Vision and hearing impairments. So as we age, we often see changes with vision, low vision, hearing impairments. And with that, even though we may be cognitively aware, we may have not actually had a decrease in our overall family or friend group around us, we start self-isolating because we recognize I can't hear the people that are talking to me as much, or I can't see or take part. And it's a personal decision, but sometimes we do see that the person begins to self-isolate when we have those pieces that start to arise, as well as difficulty navigating technology. Technology can be a wonderful piece, as many of us know, post-COVID, to being able to connect and being able to be a part of people who are very far away. Some of our family and friends are not as technologically savvy, and that's at any age. And so sometimes having that difficulty of navigating technology keeps us from being able to be in touch with some of our family and friends who would love to be able to FaceTime or Zoom with us. And that's something we have to navigate when we're looking at how much social impact we're having in our loved one's life. So post-COVID, there has been a lot of studies that really look at the negative impact of not having that social connection to others. So in here, there's a lot of studies that have shown that. So we want to talk about social isolations can significantly increase a person's risk of premature death from really all causes, and a risk that rivals those of smoking, obesity, and physical inactivity. This graph to the right is from the US Surgeon General, showing that lack of social connection and being over all of those impacts to our overall, premature death. It is also associated with about a 50% increase for a risk of dementia. Poor social relationships was also associated with a 29% increased risk of heart disease and a 32% increased risk of stroke. Loneliness is also associated with higher rates of depression, anxiety, and suicide. And loneliness among heart failure patients was associated with nearly a 4 times increased risk of death, a 68% increased risk of hospitalization, and a 57% increased risk of emergency department visits. And so a lot of times you'll see this with a loved one, with a friend who you're looking to support, and you haven't necessarily had as many comorbidities, but overall just health decline. And this can be an impact that not is always at the forefront of everyone's mind as to why that might be happening. So we always feel it's important to talk about the impacts of social connection when trying to make the decision, is it the right time to move? And again, when you look at that, how does that, overall impact happen? So we have the comorbidities, and we do have issues with health, heart disease, stroke, diabetes here. But the processes that can impact that are things like the stress hormones, inflammation within our bodies, the psychological impacts, trying to have purpose and meaning in our life, the stress, the safety concerns. Do I feel resilient? Do I have hope? But also the behaviors that have impact when we are not socially connected. So what does my physical activity look like? What is my nutrition? These are things we're going to get into later as well. But do I have more negative impacts by having that social isolation? How is my sleep? Am I having unhealthy behaviors, unhealthy habits? So all these things can play an impact when looking at our overall health if we don't have the right social connection. So as we've discussed, the physical and cognitive impact of isolation can be quite serious. And as you see this emerging, this may be that opportunity you want to look at making the move. So, when you look at an assisted living, there's a lot of things to look at with this social impact. So you have daily activities that you can look at that can engage someone physically, mentally, emotionally, and spiritually. This is a Department of Social Services guideline. Are you meeting these needs for each resident that comes into your community? And we do recognize that not all activities are a one-size-fits-all. There are people who want to be more engaged intellectually. We have our RUI University. We often have trivia tournaments between different communities where they zoom in with each other. We have book clubs, walking clubs, exercise, happy hour, outings, shopping trips, things like that. So being engaged. And I know a lot of times we hear as we talk about these things and the opportunities that they provide in the community, well, I don't think my dad would ever go to that. I don't think my mom would want to take part in that. Really that has slowed down. And it is a big change, especially if you've been home by yourself for several years and that, haven't been out and haven't been engaging. But, when you come into a community and you think about even the small impacts that you'll have from a multitude of people in the social connection. So if you move in, you know that there's going to be touch points from housekeepers. There's going to be touch points from our dining team. There's going to be touch points from our clinical team. Those people genuinely care about the well-being of the residents who move in. So encouraging them to come out to the dining room, encouraging them to come and join an activity, encouraging them to find like-minded people that they know would probably connect well. So even if it's in the beginning, it's those smaller touches. When you think about what does the social impact of a loved one look like now? How often is someone going to their home? How often are they getting out to go to things just like a store run, or to be able to be a part of a walking club, something they've enjoyed in the past but maybe don't feel safe doing now, that they can, again, build up to. So a really great opportunity to start small steps with those social impacts of having all these little touch points throughout the day, people checking in with the goal of really increasing that to thriving within all the aspects that our life enrichment team and engagement teams have to offer within a community. Now, we'll talk a little bit more about physical decline and increased ADL needs. ADLs are your activities of daily living, and physical needs sometimes are a bit more obvious than when you're looking at the social impact, and is that having a contributing factor to a decision to make a move. But same with the social impacts, the physical one, sometimes it can be a very slow progression. The needs are changing gradually over time. And so that can also still be a hard decision to say, is it a good time to make a move? So we're going to kind of talk about some opportunities to see, is it the right time? Are we seeing some of these factors? So a lot of times families will come in and say, I'm not sure how much help we're needing. I don't know if we really are to that point yet. And so one of the things we often recommend is just to really kind of take that self-reflective look at, what does the person you're looking to maybe move into, what do they need help with? When you look at that day to day, and sometimes stuff that you just have gotten into the habit of doing, we don't even think about it sometimes, right? Are we running the store and grabbing things? Are we helping kind of come over once a week and make sure that the shower's been done? Am I laying out clothes, or calling in the evening to make sure that, are you changed? Are you good? Are you ready for bed? Just those checkpoints. So, are checkpoints happening? Are you actively involved? Do you have, a grandchild or friend who's a neighbor maybe stopping over? And how often is that? So wanting to see what kind of support is needed with those activities of daily living, bathing, dressing, toileting. Is there support needed for transferring, walking, or getting around in a wheelchair safely? Even disorientation and medication management, which we'll talk more about later. So some kind of subtle signs to look for with that physical decline and increased ADL need. So we often hear my mom, my dad, they always shaved, they looked lovely, but we are noticing some change. So are you seeing that? Are you seeing that change to their personal appearance and or hygiene? So maybe not showering or changing clothes as often. Sometimes that's due to we start having fear of getting safely in and out of the shower by ourselves, or fear of falling when I'm changing my clothes. Sometimes it can be cognitive. I've forgotten that I haven't showered in a couple days. Are we sleeping in the same clothes we wore during the day? Sometimes same. That often is a safety. I'm concerned about falling. It's also easier. I'm comfortable. I'll just stay in my chair. I've got these clothes on. There's no need to change. But as a loved one, we get concerned about the hygiene and the overall health of our loved one with that. Hair not being done, being brushed, maybe not putting makeup or jewelry on that we've noticed before. And while that's not an overall sign, sometimes it's a sign that maybe the physical health, maybe there's underlying health issues that's making me not feel comfortable, not feel safe, or impacting just my overall ability to complete these tasks. There's also things just around the house when we look at that support that's needed. So housekeeping, laundry, cooking, and money management. So have you noticed any sort of weight loss? Maybe your loved one, your family, your friend who you're contemplating, is it time to move? I used to cook all the time and notice, we're not really, I don't see any cooking happening. There's not really groceries in the home. Really only eating pre-made snacks, sandwiches, utilizing spreads that are pre-made because I don't feel comfortable cooking anymore. And nothing that there's anything wrong with that, but sometimes it's a indicator that there's been a shift in what I feel comfortable doing, and sometimes just what I want to do. But that's not always what is best for our overall health. So looking at that component as well. Are there dishes in the sink? Is there things being left out? So we want to just make sure that as you're looking at those things, those can be sometimes one-offs. And it's, again, so it's this kind of gradual. Notice it, but is it becoming more frequent? Sometimes family and friends are available to assist with these things. They help cook, they help provide the showers and laundry. But sometimes that begins to exceed the availability of someone. And that may be a time to indicate, is it time to move? If someone is working and then supplementing that, you start looking at the safety as the need of focus. So as the increased need for that ADL support or overall physical decline, we start becoming concerned with things like falls, weight loss. And again, with that, if I'm not showering, if I'm not changing my clothes, again, I'm probably not going to be going out. So again, it goes back to that initial conversation of the impact on our social interaction. So we really want everyone to look their best, feel their best, and engage with other people. So in our communities, we do work with our director of clinical services and the executive director and all the team to work on an individualized care plan. So you look at these components that we talked about, and this is an ever-changing and evolving care plan, because We know that needs are not always, they don't always stay. Sometimes we need support with something and later we don't, but it ensures the needs are being met. And the goal is that you get to remove yourself from being the caregiver, and it kind of changes back that relationship dynamic. We get that this can cause a lot of strain and stress on family members as you kind of navigate work, family. Again, sometimes we're caring for multiple loved ones, friends. And so we want to be able to provide that balance where if you're the primary caregiver at this time, that you get to kind of step back and go back to a different relationship. When we step in and take over the care, the feeding, that housekeeping support, it's really important that as we work on these care plans, that it's, the resident who comes into our community feels like they have a say, the families have a say, and the community works with it to meet the needs.
Emily,
Yes.
we have one question for you.
Okay.
One of the questions was you talked about the not showering, sleeping in the same clothing. Is that one of the reasons that maybe frustration comes and there's no visits from, or they do not want any visits from a loved one?
Absolutely. So it also goes back to that relationship dynamic, independence. So it's a very different dynamic when someone who is maybe a son or a daughter or a close friend starts providing care. So I maybe know I can't provide it. And I know if you come over, you're going to help support me. And I don't want that because I want you to be my family. I want you to be my friend. And it does change that dynamic in that relationship. So it can be that first I'm embarrassed because you know me as the person who is dressed and looks nice and I'm embarrassed. And none of us, I always say, like, we don't want someone to walk, when somebody comes to your door and you're like, I am in my sweats and I don't feel good or don't look like myself. Um, they feel the same way. They want to present well. And sometimes it's that component of I'm embarrassed and I don't want anyone to see me. And then I also love this person and I don't want them to be the one having to help shower or change me. So oftentimes you do see frustration. And I'm not saying if you move in that that's immediately going to change. Sometimes, again, we work through that, usually the first 30 days of really trying to navigate the preferences. But once that it's a trust building thing, it does help alleviate a lot of that stress and frustration that you were previously seeing.
Thank you, Emily.
Yes, of course. So medication management, the social impact and physical are very important, and both can have negative health effects, as we've already talked about. Medication management to a bit more specific, if we are not managing our medications, it can be critical and often result in adverse health effects that can result in ER visits, hospital admissions, as well as an increase in duration of illnesses and even falls. So we know this is important. So if you have a loved one at home, I did attach what we look at as a self-evaluation tool, even when someone is moving into our community and says, you know, they're able to manage their own medications. So we do look at things like, are they able to correctly read labels and identify each medication? We talked about the vision changes. So sometimes if I can't properly read a label or know what I have in front of me, I could be taking the wrong medication. As we know, I think probably most people have been guilty of this. I hold on to a medication too long, it's there. So I could be grabbing something that I don't even have an order for anymore if I'm not able to correctly read it and identify what I'm taking. Do you know what that medication is for? It's important not to just be taking medications and not know maybe those side effects, what I'm taking it for. Because if I do have any sort of side effect or negative health impact, I need to be able to speak to what I have taken or what is being impacted. Do you know the time and frequency of the medications to be taken? As we know, most of this is on the label. So going back to that number one, can you read and identify the label? But again, if I assume it's every 4 hours and it's really something that should only be taken once a day, I could be overdosing myself. Do you know the quantity for each medication, the dosage? One of the biggest components is properly being able to open and close the medication without assistance. We know a lot of family members often support getting medications, laid out and ready for family members to be able to take. So sometimes this is less when you're at home, but equally important to know what we're taking and why we're taking it. Some barriers and things to really consider with the medication management
Emily,
is yes.
Thank you for allowing me to interrupt. We do have another question from the audience. They said they're thinking about making a decision from their home to a community, being proactive, not a loved one. So
Mhm.
knowing all these issues that are being discussed will eventually happen more or less. They want to know about for themselves. What does that look like for them to be proactive to move? And how do they know when a good time would be for them to move? And making sure that those kind of issues are being discussed. Um, they don't want to be too late. The person also states those problems should have sometimes they probably should have been moved earlier. They're 70 and they want to know how to best to plan a move proactively, not reactively. Thank you.
No, that is such a great question and something that we see a lot. We have a lot of people who choose to move in proactively. And what's great about that is it's very empowering when you go back to the independence. The goal is to be able to actively take part in this decision and feel confident in what you're doing. So I often recommend if you think it's something that even maybe not now, but in the near future is calling one of our communities and setting that up, knowing what your options are, being able to see what we're able to provide, and being able to take part in that care plan that we discussed. So sometimes when you move in, it's, being able to say, this is what I know I need help with, and then what I want help with. Those are two different things. There's things that we may need help with due to health issues, physical limitations, but there's also things that maybe I no longer want to have to manage and I really just want that help with. And that alleviates that stress and that burden on yourself so that you can then enjoy all the other aspects of being in an assisted living setting. So oftentimes we'll have people who say the same thing. I would rather move in early and be able to actively partake in that decision. And I think that that's great. So if that's something you're looking for, calling one of the communities, setting up a tour, being able to walk through and get all of your questions answered, being able to see the different options and being able to, again, make the decision as to when it's time. When you have that tour, we have directors of clinical services at the community who can also meet with you or set a time to meet with you when it's convenient to kind of talk over some of those things. Here's the issues that I feel like I want to have addressed now. These are things that I'm thinking in the future and being able to talk that through. So I just highly recommend calling one of our communities, coming in, meeting the team, and just being able to, even if you don't know the questions, a lot of times they'll be able to kind of show you around and answer some of the same things we're talking about now and how we can address those.
Thank you. Thank you, Emily.
Yes. So going back to medication management, there's a lot of things that you need to take into consideration when thinking about a loved one who's managing their own meds, or if you're the one managing your own medication. So at a time, there can be physical limitations. We know there's several health issues that we often see, arthritis and Parkinson's, that can make managing bottles a difficult task. So are we able to then open our medications? Are we taking them on time? Are we able to manage that? Are we missing doses because of difficulty? There may just be mobility issues, right? I'm not able to get up and get over to where they are. So today I didn't take them. I just stayed. So those physical limitations can sometimes impact if we're getting our medications. And we know if we don't consistently take our medications, then we may have adverse side effects from that. Cognitive issues. So just even remembering to take the medications as scheduled, as we talked, are you able to know when and how often you should take these? But sometimes cognitively, we just forget to, and that also then becomes an issue if we're not taking them. Equally important is if we forget that we did take them and we may have taken an additional dose. So again, we know that there's those packages where it's Monday through or Sunday through Saturday, and families will fill those. So have you ever come in and you're like, there's like 3 days where no meds were taken? Or did you come over earlier in the week and you realize all the medications are gone? So those are really important things. If you're helping support a loved one who's taking medications on their own, maybe you're helping support. Are we seeing that they are taking them? Are they taking them too much? That is something that we really would want to consider when looking if it's time to make a move, because the impacts of medication management can be quite serious. Another thing we see a lot is maybe not taking a medication because of the effects of it. So this is often a diuretic, can often make you have to get up and use the restroom more frequently. And so we do see people who will skip evening or nighttime dose because I don't want to have to wake up during the night. I'm concerned I'm going to fall. I don't want to get out of bed. So there is, again, reasons we're taking these medications. So when you look at those things in a community, we do have people who support ordering medications, properly administering medications. We also have pharmacists and physicians who we partner with who do every 6-month review. So they help from the pharmacy side, they give recommendations. Does this dose look appropriate? Is there anything that could possibly interact that we need to have the physician look at? Physicians can also help reconcile. They look every 6 months to say, well, you went to a specialist, I saw you, you went out to the ER and you went to an urgent care, and now we have maybe 5 more medications than we had on here 6 months ago, and I don't know if they're all still necessary. So if we were home, sometimes that list can get quite extensive, and there's not always someone who is reconciling that. So a really good opportunity for medication management, if that's something that you're seeing has become, as there's been increased health needs, that's being difficult to manage at home. And as we know, that's often one of the more stressful components for loved ones because they don't necessarily know all of those interactions either. We're not supposed to when we're someone who's just helping support a family member or a friend. So that is often a really good time to come in and have the conversation about what does that look like in our setting. So cognitive decline. So this one is, again, sometimes just so challenging because who doesn't often forget things? Forget a detail, forget to pick something up from the store. Where did I put my keys? But when you really start looking, at the top, we talk about like those small details. Are you seeing that more and more frequently? Are you hearing the same stories over and over? And often responding generally. So I want to be a part of that conversation, but I don't remember the details. So if you respond generally, you're still engaging, but I'm not really giving an answer that you would have expected before. I'm unable to remember those details or even having some disorientation to a familiar setting. This, again, when you start seeing this, it goes back to that first factor we talked about is now I'm not engaging in conversations because I'm embarrassed that I might have forgotten a name. I might have forget something about that story. So then I self-isolate again. So we really want to kind of keep an eye on, do we see these symptoms starting? As it kind of goes on, you may notice a decline in judgment. Someone who has always been very responsible starts not maybe paying their bills. Things around the house may not be being fixed. Maybe we're doing things like leaving the stove on or leaving a car running that start becoming a safety issue. Are we not completing tasks that you would not have seen before? So maybe somebody brought groceries over, but come over the next day and they never got put away. That we are failing to check the mail. So I'm not going to go out to, I don't go outside and next thing you know, there's a week, 2 weeks worth of mail sitting there that hasn't been addressed. And then we'll also see sometimes poor financial judgment. Maybe an organization that I've contributed to in the past, maybe it started giving contributions that were outside what is within my financial capabilities. Did I maybe give a credit card number or social security number to someone who called that used to in the past I would have picked up? I shouldn't have done that. So these are just, again, sometimes it's not as obvious because we all have that. I can forget something, I forget a name, forget a situation or story. But as you start noticing that decline in judgment, that safety concern, that really becomes a time to start looking. And again, sometimes earlier in that process can be better because you can get acclimated to a community. It becomes more familiar earlier on, and you're not waiting till it's later. And looking at that, I think it's really important. I think a lot of times people assume with the cognitive decline that it means you're going to be going to a memory care setting, and that often has, concerns from family members that I don't think we're ready for that. And then we just want to always say that not everyone that has a cognitive issue is memory care appropriate. So it's a determination that's based on a clinical team's assessment along with the physician's recommendation. So there is certain requirements that have to be met before moving into a memory care setting. But oftentimes that's the question that families have for us on when is it time to move, is I'm not sure right now. Are we more ready for assisted living, or are we more ready for memory care? And dignity and safety really become a key part of that conversation. Do they wonder? And by wonder means, am I trying to exit the house when they're home? Are they going outside and not knowing that it's 30 degrees, no shoes on, leaving? That's really a safety issue. And that oftentimes would be something that we would look at as potential memory care. Sometimes with dementia, we notice that behaviors that your loved one, friends, or yourself would never have exhibited, such as kind of abusive, aggressive, or disruptive behaviors, sometimes show themselves. So, that's something that they can't control. It's part of the disease process. But again, for the dignity aspect, our activities, our engagement in our memory care setting it's appropriate. They will have the dignity that they need. Can they appropriately engage in activities or the dining setting? A lot of times that becomes part of the conversation of where they will feel most comfortable. And sometimes our assisted living setting, it's larger. We talked about that independent structure. Will that cause anxiety or stress in a larger setting versus in a smaller setting like our memory care? So all of these things are taken into consideration, like I said, along with a physician's recommendation, along with an assessment that goes in. So we often have people that have cognitive decline that are on our assisted living settings very safely. So if that's something that you're like, I'm not sure where we're at in the process, I'm not sure which one they need, we will help work with you on finding the right setting that meets the needs of whoever you're looking for to potentially move in. So social infrastructure. So there's a lot that goes into, again, making this decision. And sometimes maybe there's support, but sometimes there's where we live doesn't necessarily provide that overall infrastructure around us to be able to have our loved one living at their best, most purposeful life. So looking at things like, do they have easy access to programs? So if you're on the more independent side and you're very social, do I have that access to be able to get to the groups or associations or volunteer opportunities that I've always taken a part in? A lot of times that's transportation. Is there ease for public transportation if I'm no longer able to drive? Is someone able to get me to my doctor's appointments? There's certain physical elements. So, so many of the people looking love to walk, being outdoors, but not everyone lives in an area that is safe to do. Do you live on a road that you can safely walk out your house and down a sidewalk and engage in that? Sometimes we live in a more rural setting where there's no sidewalks, or in an area that I'm not capable of getting in and out safely. So does the elements that surround me provide that social support? I have access to people, I have access to my physicians, I have access to my social activities that I want to take part in. So the environment of an assisted living is the foundation for social infrastructure. So without multiple resources needed, you're able to have that supportive transportation, activities, being outside, ability to walk. So the ultimate goal of the setting is to promote independence by providing the structure necessary to improve quality of life and outcomes. So looking at that of what is helping promote them at their house, and is there any gaps in that, is often a time to look at, is it the right time to move? So lifestyle, purposeful living. So just overall quality of life. So sometimes you have, and this goes back to our question earlier, you may have no physical, cognitive needs at this time. It's simply a lifestyle need, or I'm looking to maybe get ahead of, knowing I'm going to want to come in later. It helps provide independence. And I know we've said that several times, but the goal is that you're in a setting where you feel that you're capable of having support. And independence doesn't mean I don't need any care or I don't need any support, but how do we work with you so that even through the care, you feel that you're most independent? So things that you may want to change are, I'm really over the house maintenance. I don't want to clean anymore. I don't want to have yard maintenance or think about having yard maintenance. I still want to go out to my appointments, but I do need that support with driving. Maybe your home layout no longer provides a safe way for you to safely manage. So if you're a multi-story home and you downstairs is laundry, or on another floor is your bedroom, and it's just at this point I don't want to do stairs, I don't want to have to do that. I'm looking for an increase in social opportunities. I'm ready to have more things at my fingertips that I can go out and I can do and I can be a part of. And then what does that, what does a community have to offer? And when you look at that, when you have someone who's doing breakfast, lunch, and dinner for you, providing that housekeeping and laundry support, but that there's the support and friendship there too. You end up building those relationships and going back to that caregiver strain. It starts flipping that dynamic. You can come be a part of dining with someone, or if you're the one who's looking, if these are the things that you're looking for, it really allows that freedom of time to be able to take part in more things. So going back to that study from the U.S. Surgeon General, they said the 3 vital components of social connection were structure, function, and quality. So what's the structure of your social relationships look like? What's the size of people in your household that's still able to be a part? How many friends or social interactions do you have around you? For your functionality, do you have the emotional support you need? If it comes to a time of crisis, which I know none of us want, but sometimes happen, if there's an emergency setting, if there's something that comes up, is there someone there to be able to help support that? And then the quality of relationships. And that goes back to the goal of our setting is that you make friends and that you find people in your life to kind of have that social connection with like-minded people, enjoying the same activities. But even when we know in the beginning that can be challenging, you do know that you have those touch points from a lot of people who are genuinely looking out for your overall well-being. And when you're looking at that and what that looks like in a Retirement Unlimited community, there's different signature programs to meet different needs. And just kind of wanted to touch on these. I know we talked about some of them a little bit, but our RUI University, which is part of what we're doing here tonight with RUInformed, is different educational series to engage our residents. Our RUI Fit, so exercise classes, things to increase your strength, health, and well-being. Our Taste of RUI, which again is our culinary service, but is able to meet the needs of our residents who have specialized diets. If you have someone who's on thickened liquids, if you have someone who maybe is on a heart healthy or diabetic diet, things that we can help meet, as well as talking about Parkinson's, which I think most people at this point have been impacted by a friend or family that's had Parkinson's. How do we meet the needs of the dietary requirements? Lux Unlimited, so being able to feel your best, having your hair done, having your nails done, not having to leave the community for that. Leash on Live is one of our programs where you're allowed to bring your pet with you, and the team, if you're no longer able to care, can help support the needs of feeding and caring for your pet, who everyone wants to bring and loves, but being able to have them in the setting with you, which we know is really important. And Care Impact is our one-to-one caregiver. So it's team members within our community who can help on outings, going to doctor's appointments, being one-to-one if they need that support, maybe post-hospital visits. So a lot of programs ultimately looking to improve the health, mental, physical well-being of our residents. And then when you're looking to make the move, another really important thing is our goal is to try and minimize what takes you out of the community and talking about that social infrastructure. So we do have things that we partner or people we partner with to do mobile x-rays, on-site labs, podiatry visits, primary care visits on site. We have therapy providers who come into the community. So they kind of work around, again, hopefully you choose to engage in those activities. I don't have to leave the community for a therapy visit. If I have someone visiting or I want to go out, they'll change around your schedule. On-site gyms and walking paths, ability to meet any special dietary requirements. We do things with our flu shot clinics, COVID clinics. We partner with pharmacy to deliver medications. So again, when you're looking to make the move and all that goes into that decision, as we talked about, what is taking time from yourself or your loved one that would help alleviate that stress and burden. And any questions?
Any additional questions for Emily? You all did an amazing job asking questions throughout. So if you will allow me to say thank you, Emily. Emily, as our registered nurse, has done a fantastic job tonight sharing when to make that decision to move. And I want to thank everybody for deciding to join us this evening to learn more about how to make that decision, what to look for when you're talking to a loved one, and if you're ready to make the move. Remember the three important things that Emily talked about. First, have the discussion. Two, recognize that it may be time, and before it becomes an immediate need, tour a community. Ask your physician, ask a family friend. But most of all, we thank Emily for sharing her clinical knowledge tonight. And we're looking forward to next month's RUI Informed too as well. We'll have Dr. Bahiri join us to talk about heart healthy. Dr. Bahir is one of our attending physicians, and those that joined tonight, we are looking forward to sending you a link to attend. Again, we hope each and every one of you have a good evening and a great new year. Thank you to everyone. Bye bye.